Hey, it's Dr. Future, your favorite livelihood therapist and the Director of Education and Supervision for Black Therapists Matter, and it's time to test your clinical knowledge, so let's just jump right into it. Here's the question. A clinical social worker is treating an adult client diagnosed with PTSD who experiences severe flashbacks and panic attacks when discussing a past traumatic event. The client desperately wants the symptoms to stop, but becomes highly dysregulated and dissociative during trauma-focused processing. What is the first clinical intervention strategy the social worker should prioritize? Here are your options. Begin intensive exposure therapy to help the client directly confront the trauma memory. B, confront the client's cognitive distortions regarding the trauma event. C, teach the client affect regulation and grounding skills to stabilize autonomic arousal. Or D, administer a psychoeducational assessment to measure the severity of the PTSD symptoms. Quickly. The answer is C, and here is why. I know you have seen or heard me say in numerous videos that it is your responsibility to manage your responses to being triggered, and that is kind of leaning to what this question is talking about. We are supposed to be teaching individuals to manage their autonomic responses to when they are triggered to situations, whether it is PTSD, acute stress, any of those things, anxiety, all of the things. It is never a good idea to focus your attention on trying to manage triggers, because it's too many. There can be internal triggers. Those are emotions, those are feelings, those are memories that you have that just come from nowhere. There can be external triggers that are things that come from your sight, your smell, your taste, the way you feel on your skin. You can't manage those things, and you have no control over other people's behavior that can be triggering to you. But what you can control, what you can manage, is your autonomic responses to when you are being triggered. And so if you're working with an individual and these things happen, you want to first make sure that they know how to regulate themselves. You're going to do that before you try to confront them about any cognitive distortions that you may or may not be aware of, because let me tell you something. Confronting people is going to cause some dysregulation, and you want them to be able to regulate themselves. You don't want to do anything that's going to re-traumatize an individual and then send them out into the world with new negative experiences that they have to learn to deal with. And you're not going to be administering the psychoeducational assessment because you should have done that day one. So, you got the knowledge. Go forth and be great.